Well, I spent the last 30 years basically developing the field of fetal surgery. So I'm a pediatric surgeon, but we're interested in doing things before birth, and that's how we spent all that time doing both the experimental part of it and the clinical part of it. So fetal scarless healing was something we stumbled across essentially by accident. And in those early days when we were doing the first things on in animal models on fetuses, and then when we started doing the first humans, we noticed that if we made incisions on the fetus early enough in gestation, you couldn't find them at birth. They would essentially disappear. We spent a lot of time in the 80s, I guess, doing experiments to figure out whether it was innate to the fetal tissue, some of it is, or innate to the fetal environment, particularly exposure to amniotic fluid and just that whole environment. And a little bit is that. But obviously it has huge implications for other things, just the healing process and scarring in general. And well, amniotic membrane is just fascinating because of course it's fetal. Of course it's a barrier. Of course it's an immunologic barrier. It is what allows the species to survive, because every fetus is a transplant, and as you know, they don't get rejected. And so part of the answer is it has something to do with the biology of that membrane. One of the things we started doing about 15 years ago is looking into whether it made sense to repair fetal myelomeningocele. So you have exposed neural tissue on your lower back, and you probably know all the consequences of that. So we did it first experimentally, of course, and then clinically, and now it's been shown in a really big, expensive, proper NIH-sponsored trial to be effective. So it's therapy. And sometimes the hole is so big you can't close it. It's called rachesthesis. The neurosurgeon and I were saying, holy criminy, we can't get this thing closed. And so I said, oh, we need something to cover it. Well, look, here's a fetal membrane sitting right here. So we cut a little piece out of the membrane. Of course, we'd already had the uterus open, so we had the edge of the membrane, and sewed it over the plaque in the fetus. And because we didn't really have anything else to do. And that kid turned out to be fantastic. The neurosurgeon went crazy. He said, this is like a miracle. You could argue any place that you want to decrease scarring, fibrosis, increase remodeling or regeneration, that it would be that it should be tried.